Hello dear learners, welcome to our new video. In this video we'll be talking about endocrine system part 2. In the part 1 we have discussed about what is endocrine system and what are the classification of hormone that constitutes the endocrine system. Today in this video we'll be discussing about one of the important endocrine gland of the endocrine system, which is nothing but pituitary gland. So now you can see here, pituitary gland, basically it is called master gland. Why it's called master gland? You can see because it secretes more than 5 hormones from itself. There is no other gland which can secrete so many hormones from itself, but pituitary gland secretes so many hormones. Like you can see, follicle stimulating hormone, luteinizing hormone, growth hormone, adrenocorticotropic hormone, and then oxytocin and vasopressin. Now you must be knowing that it is called master gland, but there is another master of this master gland, which is hypothalamus. Hypothalamus is controlling all the secretions of pituitary gland. Pituitary of course secretes so many hormones from it, which regulates varieties of our bodily functions. But when pituitary gland has to secrete this particular hormone, or when pituitary gland has not to secrete a particular hormone, it's all decided by another gland, which is hypothalamus, and hypothalamus is called the master of this master gland. Now hypothalamus is situated above the pituitary gland. If you look at the structure of pituitary gland, you will become very clear that because pituitary gland is situated at the top of pituitary gland is situated below the hypothalamus gland. So that means pituitary gland will be under control of hypothalamus gland, which is situated at the top of it. Let's see the structure of it. If you see, this is the hypothalamus, and from this hypothalamus there is this lobe-like structure. This is hypothalamus, right? This is hypothalamus, and this is pituitary gland. Now you can see pituitary has 2 lobes. This is anterior pituitary lobe, and this is posterior lobe of pituitary gland. Now these 2 lobes are connected to this hypothalamus via a stalk-like structure called infundibulum. Let me write it again. It's a little bit of messy. Infundibulum. Okay. So this is the basic structure of pituitary gland. Now you see, pituitary gland is lying just beneath the hypothalamus gland. Now there is an intermediate structure in between these two between two anterior and posterior lobe of pituitary gland. This portion is called pars intermedia. It is called pars intermedia. So basically this pituitary gland is P-shape. It's like a matar ka dana, and it's situated at the base of your brain inside a bony cage. It is lying within that bony cage, and this bony cage is at the base of your brain. And if you look at the position of pituitary gland from the point of view of hypothalamus, it is lying just beneath the hypothalamus. Now if you see the diameter of pituitary gland, it's very, very small. Its diameter is around 1.5 centimeter, and if you see the weight of pituitary gland, it's only 1 gram. So now you can see this is a very small gland. Now pituitary gland again, now if you see the structure, you can see that very clearly it has 2 lobes. One is anterior lobe and second is posterior lobe. Anterior lobe is called adenohypophysis and posterior lobe is called आपका neurohypophysis. Now this adenohypophysis by itself secretes these kinds of hormones. You can see first is follicle stimulating hormone, second is luteinizing hormone. These 2 hormones comes under gonadotropins. Gonadotropins are the cells which secretes these 2 hormones called follicle stimulating hormone and luteinizing hormone. There is one more hormone secreted from the somatotropic cells of the pituitary gland, which is called growth hormone. Growth hormone is like, it basically acts like an insulin-like growth factor. It helps in the growth of our body. Next, there is another hormone called adenocorticotropic hormone. Adenocorticotropic hormone it's very clear from its name that it stimulates the secretion from the adrenal cortex of your adrenal gland. An adrenal gland, it is situated on the top of your kidney. This is a kidney. Okay, and at top of it there is a cap-like structure which is called adrenal gland. This adrenal gland secretes certain hormones like adrenaline and cortisol. So this adenocorticotropic hormones controls the release of cortisol. What it controls? It controls the secretion of cortisol. Okay, now let's know the another hormone from the pituitary gland is thyroid hormone. As you all know, thyroid gland is the most important gland in our body because it performs almost every kind of bodily function in our body. So thyroid hormone is again secreted from the anterior lobe of our pituitary gland. Moving on to the posterior part of pituitary gland. This posterior part of pituitary gland basically consists of special glial-like cells called pituocytes, and these pituocytes secretes oxytocin and vasopressin. Now let's understand the important role of these hormones. Let's first of all discuss role of FSH. See, FSH stands for follicle stimulating hormone. So what will be its function? Its function is to stimulate the follicle formation in female body. It helps in the formation of oocyte. So basically it is very important for the sexuality of female body, and additionally it also helps in the secretion of female sex hormone estrogen. Moving on to the luteinizing hormone. Luteinizing hormone helps in the secretion of sperm production from the testis in male's body, and in females it helps in the secretion of progesterone, which is a hormone responsible for the maintenance of pregnancy in females. Moving on to the growth hormone. Growth hormone, as the name suggests, it is important for your growth, your cells. Additionally, it is also important for the metabolism of proteins, fats, carbohydrates, plus it also helps in the development and synthesis of bones and cartilages. Okay, next, this growth hormone is also called insulin-like growth factor because it helps in the synthesis of certain growth factors like insulin. Its action resembles with insulin. And then comes adenocorticotropic hormone. This secretes cortisol from it, and cortisol has varieties of function in our body. First, the important function of ACTH synthesized cortisol is it prepares our body for the stress responses. Whenever stress comes to our body shows a particular kind of a response. So for that response, this cortisol is responsible. It is playing very important role for preparing our body to show a response for a stress-like condition. Additionally, it also helps in the metabolism of carbohydrate, proteins and fats. Moving on to the thyroid hormone. As you all know, thyroid plays very critical role in metabolism. So whenever you are feeling low, that means there is not going proper metabolism in our body. And you know that metabolism is basically consists of two parts, anabolism and catabolism. Anabolism is a build-up process and catabolism is a breakup process. When there is a balance between these two processes metabolism, so there will be balanced, there will be no problem. But when there is a high rate of catabolism than anabolism, what is going to happen? You will feel very low, very lethargic, and it happens when there is a low level of thyroxine in blood. So any patient who is feeling very lethargic, so the doctor would always advise him to go to check for his thyroid level, because low level of thyroxine might be a cause for your lethargic condition. Moving on, there is another hormone which is called oxytocin. Oxytocin is very important hormone for the pregnant females. There is no important reported role of oxytocin in the non-pregnant females and the males, but in pregnant females it plays very important role. What it does? It actually helps in promotion of labor. Whenever there is a pregnant woman, her uterus is comprising of a newborn, you can say an infant. So the uterus wall starts contracting more and more and helps the baby to push out, and it helps the ejection of baby from the vagina very easily. So it helps in the childbirth. So due to the reported functions of oxytocin, now we have synthesized oxytocin available in the market, which are used by the obstetrician to stimulate the labor pain for promoting the easy delivery of a child. This oxytocin has another role other than this labor induction. It also helps in production of milk because it stimulates the mammary glands. When a newborn baby or an infant starts suckling the breast of a mother, this stimulates the release of oxytocin, and this is stimulated by the release of oxytocin, and it helps in that milk ejection from the breast. Another hormone is called vasopressin. Vasopressin has another name called antidiuretic hormone. This is called ADH. Let's write here. This is ADH. A for anti, D for diuretic, H for hormone. Now you know diuretic means the substances which increases the flow of urine. Anti means opposite of diuresis. So this hormone will, what it will does, it prevents the urine flow. How it prevents the urine flow? Actually, it stimulates the renal tubules to reabsorb all the water, thereby the water which is going into the urine gets reduced, and thus it helps in increasing the blood volume and blood pressure. So whenever there is a drop in BP or there is a drop in blood volume, what is going to happen? ADH will stimulate. The ADH will stimulate. When the ADH will stimulate it, I will tell you at the end of the video. ADH stimulates, and this release of ADH will, what it does, it stimulates the renal tubule of kidney. What to do? To reabsorb the water. So when the water gets reabsorbed, water enters into the blood stream. So when water is entering into the bloodstream, so the reduced blood volume will get increase. As a result, when the blood volume is higher, so it will start increasing the blood pressure also. So this is how these hormones plays important role in the human body by performing varieties of function. Now, I must tell you one thing is that this we have studied that this hypothalamus is the controlling body or the regulating body for the secretion secreted by pituitary gland, right? How hypothalamus does so? Actually, your hypothalamus has two different kinds of hormone. One is releasing kind of hormone and second is inhibitory kind of hormone. So whenever hypothalamus secrete releasing hormone, it reaches to the pituitary gland via this infundibulum. For example, if pituitary gland has received gonadotropin releasing hormone, so pituitary gland will, what it does, pituitary gland will start releasing growth hormone into the bloodstream. As a resultant, higher level of GH in the blood will stimulate our growth. It will promote the growth of our cells. But when hypothalamus releases inhibitory hormone, like in case of growth hormone, if hypothalamus releases growth hormone inhibiting hormone, so this growth hormone inhibiting hormone, when reaches to the pituitary gland, it tells the pituitary gland to stop producing more and more growth hormone into the blood. So pituitary gland stop further release of growth hormone into the bloodstream, and thereby this hypothalamus is regulating the level of hormone in our body. But there is one more thing. What happens when there is no, you can say, let me rub this. Actually what happens, hypothalamus doesn't have inhibitory hormones for every kind of hormone. For example, let's say thyroid. For example, let's say this is hypothalamus, right? Hypothalamus, for example, it had releases ACTH, adenocorticotropic releasing hormone. Okay, so this hormone will reach to the pituitary gland, and pituitary gland will start releasing adenocorticotropic hormone. That is, this hormone will reach to this adrenal gland. This is the adrenal gland situated, where it is situated? It is situated at the top of your kidneys, on both the kidneys. So what happened? This ACTH will reaches to the adrenal gland, and adrenal gland will start releasing cortisol in the blood. But the thing is, this hypothalamus doesn't have this adenocorticotropic inhibitory hormone. So when the cortisol level is rising in the blood, how this is going to regulate by the hypothalamus? Actually what happens, hypothalamus is the regulating body, but it does this effect either by its by its inhibitory hormone or by some neurological components, by the, you can say, the nervous system. So what is going to happen here? As the level of cortisol increases in the blood, what it does, it shows a negative feedback mechanism. Either it goes to the pituitary gland to inhibit the release of ACTH, or it gives a signal to the hypothalamus to stop releasing the ACTRH. So when, let's take this case, when this high level of cortisol is giving a signal to the hypothalamus via nerve ending that already there is more amount of cortisol in the blood, so stop secreting more and more of this ACTH, or more and more of this cortisol from the adrenal gland. So what it does, high level of this cortisol signals reaches to the hypothalamus, and it stops the release of adenocorticotropic releasing hormone. So when there is no ACTRH reaching to the pituitary gland is not going to release the adenocorticotropic hormone. So there is no ACTH, so there will be no stimulation for the adrenal gland to secrete the cortisol. Either one another way is, sometimes the high level of cortisol is received by the neurons, and then this neuron, the neuron goes to the pituitary gland in order to stop the secretion of this ACTH, and resulting into the reduction of cortisol in the blood. So this is how the regulation of hormones happens either via hypothalamic control or via some neurological control. This type of mechanism is called negative feedback mechanism. Let me write here. It's a negative feedback mechanism. All right. So now comes what happens when all the hormones secreted from the pituitary glands are not releasing in a regulated amount, or you can say when there is a disturbances in the amount of hormones secreted from the pituitary gland. What is going to happen? This condition is called panhypopituitarism. Panhypopituitarism is a condition when the anterior pituitary gland stops secreting varieties of hormones, like whatever it was secreting, like GH, GnRH. So when the release of those hormones stops, ultimately the level of hormones in the blood will get affected, and the activity performed by those hormones will also get affected. So this condition is called, let me write here, this is called panhypopituitarism. Now this panhypopituitarism is characterized by three major symptoms. The first symptom of this condition is lethargy. See, you feel energetic when there is a metabolism of carbohydrate, proteins and fats are going on in your body in a very controlled and in a very good manner. And it is going to happen only with the help of some hormones like thyroid, okay, ACTH. So these hormones are not there because this is a condition where the anterior pituitary gland stops secreting the hormones from itself. So first symptom you will see the lethargy, and second symptom you will see that gain in weight, because there is no thyroid hormone again, because you know that anterior pituitary gland secretes thyroid hormone from itself. So if there is no anterior hormone is secreting, what is going to happen? Thyroid level will also get reduced in the blood, and thyroid helps in the fat mobilization. So there is no thyroid, there will be no fat mobilization. So ultimately you will experience gain in the weight. And the third is the lack of sexual desire. There will be lack of sexual desire because you know that gonadotropins are also releasing from the anterior part of your pituitary gland, like FSH and LH. These two hormones they helps in the secretion of male and female sexual hormones, which ultimately plays important role in the sexual desires or in the libido. So when there is no secretion of FSH and LHH, there will be less, you can say there will be reduction in the sexual desire, or there will be loss of libido. This condition is also called loss of libido. So this is all about the pituitary gland. It's a type, it's a 2 lobes and the hormones secreted from these 2 lobes, and one disorder which is basically called panhypopituitarism. So hypo का मतलब you already know that hypo means low. So pan यहाँ पर क्या कह रहा है? It is basically telling you that the all hormones secreted from the anterior lobe of pituitary glands are reduced in the blood. Your anterior lobe of pituitary is not secreting the hormone which it is supposed to secrete. So this condition will call panhypothyroidism, and it is easily characterized by these 3 main symptoms. First is lethargy, second is reduction in sexual desire, and third is gain in weight. So that's all for today videos. In upcoming videos I'll be telling about the other endocrine gland. So stay tuned with me. If you like my content, please do like, share this content with your friends, and subscribe to my channel. Thanks for watching.